Well, first off, we will hire back all of the inspectors that the Liberals fired when they were in charge back in 2016. And of course, the Conservatives never replaced those people that were fired. Secondly, we will not, like the Liberals did, fire over 1,000 nurses. We're going to make sure that we have people that are there to provide the care. We're going to ensure also that PSWs are hired and earn a wage that deals with the ongoing turnover and the lack of fairness for PSWs in the province. I think most importantly, though, what we're going to do is we're going to take profit out of long-term care. We're going to end people making money off of people who are more advanced in their lives. In some cases, people who obviously need ongoing treatment. Nobody should be making a dime off of people who find themselves in that situation. One of the serious problems that we find with home care is there's not enough people to do the work. It is a low-wage occupation at present. We're going to change that. We're going to ensure that the compensation for PSWs is significantly increased by $5 an hour. We're going to put $1 billion into home care. Home care is like a prudent use of taxpayers' dollars. Home care has been shown time and time again to be a great way to ensure that those folks who are not quite comfortable to go stay in an institution where it costs more money, because again, our position is that long-term care should be put under the public domain. Home care is something we need to invest in. We need to hire nurses, and that's our plan. We need to make sure that there's fair compensation for PSWs, that we hire a lot more of them, and we're going to put $1 billion into it. Enough with Liberal and Conservative nickel and diming of our home care system. It's a prudent investment, and it's the right thing to do, and that's what our party's going to do. Well, I'll tell you what we're not going to do, which is what the Liberals did, which is lay off over 1,000 nurses and freeze hospital budgets. That's what we had when we had the Liberals were in charge. That's where the term hallway medicine was coined. With respect to the Conservatives, I think we can all agree that the nickel and diming of healthcare under the Conservatives has also been a fiasco. If you saw what happened during the pandemic, we talked, your question talks about wait lists, etc. We need to hire nurses, lots of them. We need to hire more than 30,000 nurses to do the work that needs to be done. And we need to invest a lot more money in PSWs, increase their wages by $5 an hour. And we need to focus on not only acute care, but we also need to focus on long-term care, and we need to focus on home care. These are all things that we need to do to ensure that people get the care that they need in the province, because they don't now. We don't have enough doctors. Nurses are burning out, and that's because we've been nickel and diming our healthcare system under Liberals and Conservatives for decades now in this province. We are going to overhaul the system, invest in it, hire people to do the work, and treat it like the way it should be treated, which is an absolutely vital service for our community. And we're going to take private profit out of it. Well, one thing's for sure, and I've spoken about this earlier, we need significant investment into long-term care and into home care. Again, these are systems that have been nickeled and dimed by the Conservatives and the Liberals over the last 2 decades. We need to take the profit incentive out of these systems and invest heavily in them, because these really are systems that seniors rely upon, heavily. Another thing I can say is someone who works in the labor movement, I believe strongly in pensions and retirement plans. I think we need to do everything we can to ensure that seniors have the means that they need to be able to put food on the table, put a roof over their head, and have a sustainable livelihood. And so to do that, we have to ensure that there's retirement supports in place, pension plans, and all this has to be done, of course, in consultation with seniors groups across the province. That's something our party supported for a long time. In fact, Member Provincial Parliament Linda May Lindo, NDP MPP, introduced a private members bill in 2020 to make this a reality. And so the NDP has been pushing for this for years. We even had a member of our caucus introduce a private members bill. We need to have an independent advocate that's accountable. And so that's absolutely a priority for our party, and has been for a long time.